Welcome to Nourish Nutra, your ultimate destination for information on living a healthy and happy life. From wellness and nutrition, to fitness and mental health, we are dedicated to helping you achieve optimal health and well-being. Discover the latest tips and techniques for living a healthy and balanced life. So get ready to take your health and well-being to the next level. Subscribe now, and click the notification button to stay updated with our latest videos. Today, we will be discussing an important health topic: high blood pressure, and ways to reverse it naturally. High blood pressure, or hypertension, affects millions of people worldwide. It is the leading risk factor for heart disease and stroke. It can also cause damage to other organs in the body. Studies have shown that hypertension is the second most common risk factor for premature death worldwide. The World Hypertension League, (WHO), estimates that approximately 10% of global healthcare costs are due to high blood pressure and its complications. We will be looking at effective and simple ways to lower your blood pressure naturally. We will start by looking at what high blood pressure is. Blood pressure is one of the body's key vital signs, and describes the force of circulating blood on the walls of blood vessels. A condition where this force of blood against the blood vessel walls becomes too high is known as high blood pressure, or hypertension. The heart muscle activity can be divided into two phases: systolic and diastolic. During the systolic phase, blood is pumped from the heart into the circulatory system, while in the diastolic phase, the heart chambers are filled with blood. Both phases can be monitored using a blood pressure monitor, which gives the reading for each phase. The first reading, the systolic blood pressure, is always higher, while the second reading, the diastolic blood pressure, is usually lower. The measurement is in millimeters of mercury. Hypertension is staged, based on these readings to help guide treatment. Stage 1 hypertension ranges from 130 to 139, for the systolic reading, or the higher number, and 80 to 89, for the diastolic reading, or the lower number. Stage 2 hypertension ranges from 140 or higher, for the systolic reading, and 90 or higher, for the diastolic reading. A situation where the systolic and diastolic readings are higher than 180 and 120 respectively, is considered a hypertensive emergency. There are two main types of high blood pressure: essential hypertension, and secondary hypertension. Essential hypertension, also known as primary hypertension, usually has no identifiable cause. It is the most common type of high blood pressure, accounting for about 95% of cases. It tends to develop gradually over time, often as a result of lifestyle factors such as diet, frequency of physical activities, and body weight. Secondary hypertension is usually caused by an underlying medical condition such as diabetes, kidney disease, and other health-related issues. In some cases, treating the underlying cause of secondary hypertension can help lower blood pressure. How can you know you have high blood pressure? High blood pressure often develops slowly and without symptoms. That is why it is referred to as the silent killer. However, in some cases, people with high blood pressure may experience symptoms like headaches, palpitations, irregular heartbeats, pounding in the chest, neck, or ears, feeling sick or unwell, dizziness, nausea, fatigue, blurred vision, bloodshot eyes, chest pain, shortness of breath, difficulty breathing, anxiety, and nosebleeds. These symptoms, however, can also be caused by other conditions. Healthcare providers normally use a blood pressure cuff, usually placed around a patient's arm, to check their readings. You can also use a home blood pressure monitor to check your readings. Home monitoring is a great way to keep track of your readings. We hope you're enjoying this video. Kindly click the like icon. And don't forget to subscribe, and also hit the notification button to stay updated with our latest health and wellness videos. Next, we will be looking at the causes of high blood pressure. There are several possible causes of high blood pressure. Some of them include lifestyle factors, medications, and other health issues. We will first look at lifestyle factors that can lead to high blood pressure. Some of the common lifestyle factors that contribute to high blood pressure include diet, not exercising regularly, and stress. Let's take a closer look at each of these factors. Consuming too much salt often leads to high blood pressure. Salt is composed of two minerals, sodium and chloride. Sodium is the mineral that is most closely associated with blood pressure. A high-salt diet disrupts the natural sodium balance in the body. When we consume a high amount of salt, the body retains more water in order to balance the concentration of sodium in the blood. This leads to an increase in blood volume, which causes an increase in blood pressure. Excessive salt or sodium consumption, defined by the World Health Organization as greater than 5 grams of sodium per day, has been shown to increase blood pressure. When the kidneys are not able to excrete the excess sodium, it will cause the blood vessels to constrict, which increases blood pressure. Additionally, consuming high levels of salt can damage the blood vessels over time, making them less elastic, and causing an increase in blood pressure. Trans fats and saturated fats are also major causes of hypertension. Trans fats are mostly artificial fats that increase the shelf life and stability of packaged foods. Foods high in saturated fats include fatty cuts of meat, meat products like sausages, hard cheeses like cheddar, cream, butter, savory snacks like popcorn and cheese crackers. Palm oil, coconut oil, chocolate confectionery, biscuits, cakes, and pastries are also high in saturated fats. Consuming them raises LDL, or bad cholesterol levels, and lowers HDL, or good cholesterol levels. LDL cholesterol can build up as fatty deposits or plaque on the walls of the blood vessels. This makes them narrower and less elastic, thereby causing blood pressure to increase. Another dietary factor that can contribute to the ailment is caffeine. Found in coffee, tea, and certain energy drinks, caffeine can cause blood vessels to constrict, leading to an increase in blood pressure. Additionally, caffeine can also increase the release of stress hormones such as adrenaline, which can also contribute to an increase in blood pressure. Studies have shown that alcohol significantly increases the heart rate. It can also cause the blood vessels to dilate, temporarily decreasing blood pressure. Blood pressure, however, usually increases a few hours after alcohol consumption. Additionally, it can lead to weight gain, and an increase in inflammation in the body. Drinking too much alcohol over a long period of time can lead to chronic hypertension, which increases the risk of heart disease and stroke. Smoking is another lifestyle factor to consider. Nicotine, the addictive substance in cigarettes, can harden the arteries and also cause them to constrict. It can also increase heart rate and blood flow to the heart. Carbon monoxide, another substance found in cigarette smoke, reduces the amount of oxygen the blood can carry and increases the amount of cholesterol deposited on the walls of the blood vessels, causing them to constrict and harden. Smoking can also increase the production of stress hormones, such as adrenaline, which can also lead to constriction and hardening of the arteries. Although not often mentioned, too much sugar can also contribute to high blood pressure. Consuming high amounts of refined sugar, found in processed foods and drinks such as candy, cookies, and soda, can lead to weight gain and an increase in inflammation in the body. Not exercising regularly can also lead to weight gain and higher heart rates. Excess weight causes changes in the blood vessels, kidneys, liver, and other parts of the body. These changes often increase blood pressure. Being overweight or obese also raises the risk of heart disease. High stress levels can also raise blood pressure temporarily. The body releases a surge of hormones when under stress. These hormones cause the heart to beat faster and the blood vessels to narrow. These actions elevate blood pressure for a relatively short period of time. However, there's no proof that stress by itself causes long-term high blood pressure, but reacting to stress in unhealthy ways can raise blood pressure and increase the risk of heart attack and stroke. Some other medical conditions, such as kidney disease, diabetes, hormonal imbalance, and sleep apnea, can cause secondary hypertension. Among the known causes of secondary hypertension, kidney disease ranks highest. The kidneys regulate the balance of fluids and electrolytes in the body. When they are not functioning properly, they may not be able to remove enough fluid from the bloodstream. This leads to an increase in blood volume and subsequently, an increase in blood pressure. Additionally, the kidneys produce a hormone called renin, which helps regulate blood pressure. When damaged, they may produce too much renin, which raises blood pressure. Kidney disease can cause damage to the blood vessels as well. Diabetes is another disease that can lead to secondary hypertension. This can come as a result of an increase in blood sugar levels, which can damage the blood vessels over time, causing them to be less elastic, and more prone to constriction. Diabetes can also lead to a buildup of fatty deposits in the arteries, making them narrow, and increasing resistance to blood flow. Severe cases of diabetes can damage the kidneys, affecting their ability to regulate blood pressure. Sleep apnea is a disorder that makes someone stop breathing multiple times during night sleep. When breathing is disrupted, carbon dioxide builds up in the body. The body also senses that it is not getting enough oxygen, so it responds by releasing stress hormones such as adrenaline, that cause constriction of the blood vessels. Sleep apnea also leads to fragmented sleep and sleep deprivation, resulting in an increase in blood pressure over time. An imbalance in certain hormones like aldosterone, renin, estrogen, progesterone, testosterone, and thyroid hormones can equally lead to hypertension, because these hormones play a vital role in regulating blood pressure. Some medications can also cause secondary hypertension. Oral contraceptives contain hormones such as estrogen and progestin, which can increase blood pressure. Nonsteroidal anti-inflammatory drugs, NSAIDs, used to reduce pain and inflammation, can elevate blood pressure by making the blood vessels constrict and retain more fluid. They include over-the-counter medications such as ibuprofen and naproxen, as well as prescription medications like celecoxib and diclofenac. The risk posed by NSAIDs is higher in older adults, people with hypertension, and people taking other medications that affect blood pressure. Other factors, such as age, gender, and family history, should also be taken into consideration. The probability of hypertension tends to increase with age, especially in people over the age of 40. Until about the age of 64, the condition is more common in men. Women are more likely to develop hypertension after the age of 65. Also, the chances are usually higher for people with a family history of the disease. Genes do play a role, but it is also likely that people with a family history of the ailment share common potential factors, like diet and lifestyle, that increase their risk. If left uncontrolled, hypertension can lead to serious health problems. These health problems come as a result of the damage it causes to the blood vessels and organs in the body. We will be looking at some of them. When the blood vessels are narrowed or damaged as a result of hypertension, the heart finds it more difficult to pump blood. This can lead to an increased risk of heart attack and heart failure. It can also contribute to the development of other cardiovascular problems, such as coronary artery disease, arrhythmias, and an enlarged heart. Damage to the kidney's blood vessels reduces their ability to filter waste from the blood, resulting in eventual kidney failure. Damaged blood vessels in the body can also result in blood clots. Blood clots can hinder the flow of blood to the brain and cause a stroke. Blood vessels in the brain can also be damaged. When this happens, there is a risk of stroke, memory loss, and eventual cognitive decline. Peripheral arterial disease, PAD, a condition where the arteries in the legs, arms, stomach, or head become narrowed and cause pain, cramping, and fatigue, can also happen as a result of high blood pressure. Hypertension can also cause the walls of blood vessels to weaken and bulge, leading to a potentially life-threatening condition called an aneurysm. In some situations, the blood vessels in the eyes can be affected, resulting in vision loss and even blindness. It can also lead to a condition where fluids build up under the retina, causing it to detach from the back of the eyes. This is known as central serous retinopathy. High blood pressure can also damage the optic nerves, which carry visual information from the eyes to the brain. However, complete loss of vision as a result of high blood pressure is not very common. Sexual dysfunction is another problem that can be caused by high blood pressure. It can cause damage to the blood vessels and nerves in the pelvic area. This can reduce blood flow to the genitals, making it difficult to achieve or maintain an erection, or to become aroused. Also, some medications used to treat high blood pressure, such as diuretics, beta blockers, and ACE inhibitors, can also cause sexual dysfunction. As we continue our discussion on high blood pressure, make sure you like our video. Also hit the subscribe button to stay updated with our latest videos on health and wellness. While medications are essential, it is possible to manage or even reverse high blood pressure naturally. Here, we'll go through a number of proven methods for lowering blood pressure naturally. Ensure that you discuss your plans with your doctor. Regular exercise is one of the most effective natural ways to manage blood pressure. Your heart pumps more vigorously and quickly when you exercise. This enhances circulation, boosts muscle power, lowers blood pressure, and improves cardiovascular health in general. In addition to lowering blood pressure, exercise also improves mood, controls weight, and lowers the risk of developing chronic diseases. Try to get about 30 minutes of moderate exercise at least 5 days a week. This can be a simple activity like a brisk walk, a bike ride, or swimming. Your cardiovascular health can be improved by engaging in even basic hobbies like gardening or playing with your kids. The goal is to incorporate physical activity into your daily routine. A healthy diet is another effective way of lowering blood pressure. Certain nutrients and food choices have been shown to have significant effects. Potassium is one of the essential nutrients that help manage hypertension. It does this by balancing the amount of sodium in the blood. Bananas, oranges, potatoes, and spinach are all excellent sources of potassium. Another important nutrient is magnesium. Magnesium helps relax blood vessels and improve blood flow, reducing blood pressure. Good sources of magnesium include almonds, spinach, and avocado. It has been shown that eating a diet high in fiber can also be helpful. Because fiber is a form of carbohydrate that the body cannot digest, it neither raises insulin levels nor affects blood sugar levels. Increased fiber consumption has been shown to lower systolic blood pressure by an average of 3 to 4 millimeters of mercury. This decrease is believed to be a result of fiber's ability to lower salt and cholesterol absorption. Whole grains, fruits, vegetables, nuts, and legumes are all excellent sources of fiber. Soluble fiber, which is present in foods like oats, beans, and apples, is especially helpful. For the best health benefits, aim for at least 25 to 30 grams of fiber each day. In addition to containing these specific nutrients, a healthy diet should also be low in salt, saturated and trans fats and processed sugars. The DASH, dietary approaches to stop hypertension, has been shown to be effective. The DASH diet emphasizes the consumption of whole, unprocessed foods like fresh fruits and vegetables, whole grains, and lean protein, and limits the intake of salt, sugar, and unhealthy fats. Reducing alcohol consumption is essential for managing blood pressure. Since alcohol can increase heart rate and blood pressure even in small amounts, adhering to the recommendation of the American Heart Association of no more than 1 drink a day for women, and 2 drinks a day for men, will reduce the risk of hypertension and other chronic health disorders. 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of spirits constitute 1 drink. The same also applies to caffeine. One should not consume more than 400 milligrams a day, which is about 4 cups of coffee, based on the recommendation of the American Heart Association. However, depending on the type and amount consumed, a cup of coffee may contain 50 to 200 milligrams of caffeine. Apart from coffee, other foods and beverages can contain varying amounts of caffeine. Tea, energy drinks, chocolates, energy bars, decaffeinated coffee, and some painkillers all contain varying amounts of caffeine. Research has shown that quitting smoking can drop blood pressure within a few weeks. Also, quitting for a longer period of time can have a more significant effect. When giving up smoking, it's also crucial to get assistance. The process of giving up smoking can be made easier and more successful with help from friends, family, and support groups. Fasting, that is, going without food or liquids, apart from water, can also have a significant effect on blood pressure. Doing this for a brief period, less than 48 hours, may not have much impact, but longer fasts can produce a more significant result. This is because the body starts using stored fat and glycogen for energy, which in turn causes a decrease in the volume of body fluid. The effect can vary, depending on the person and the kind of fasting being practiced. This, however, should not be used as an exclusive method of lowering blood pressure. Before starting any fasting program, it's important to consult a healthcare professional, because not everyone should fast, especially if they have specific medical issues or are on certain medications. Reducing stress, especially chronic stress, can have a positive impact on blood pressure. The effect may vary, depending on the individual. Exercise, meditation, and sleep are all common methods that can reduce stress. People have used meditation for thousands of years as a way to relax and reduce stress. Meditation involves calming the body by taking slow deep breaths to help the body relax, and the mind focused on the present moment. When you meditate, your body goes into a deep state of relaxation, which will reduce stress and thus help lower your blood pressure. In one study, It was shown that elderly patients with difficult-to-treat isolated systolic hypertension, who completed a meditation and relaxation response training, observed a significant drop in their blood pressure. Further studies showed that regular meditation and relaxation caused a reduction in blood pressure by widening the blood vessels, reducing inflammation and blood vessel constriction. This reduction in blood pressure seems to be facilitated by nitric oxide, a chemical produced naturally in the body, that aids in blood vessel relaxation and dilation. Nitric oxide levels in the breath were shown to be higher in people who practiced the meditation and relaxation response for 8 weeks, compared to the control group who did not. Adequate sleep also helps to control blood pressure. This is because getting enough sleep helps the body reduce stress hormones. In order to get enough quality sleep, it's important to establish a regular sleep routine. This includes going to bed and waking up at the same time every day, avoiding caffeine, alcohol, and nicotine in the evenings. Creating a sleep-conducive environment by keeping the bedroom cool, dark, and quiet will also help. Additionally, practicing good sleep habits such as avoiding screens before bedtime and engaging in relaxation techniques such as meditation or deep breathing can also help improve the quality of your sleep. It's also important to remember that quality of sleep is just as important as quantity. Aiming for 7 to 9 hours of uninterrupted sleep each night is recommended for optimal health. As we conclude our discussion on high blood pressure and ways to control it naturally, remember that lifestyle changes such as eating a healthy diet, regular exercise, reducing stress, and quitting smoking can be very effective. Don't ignore any warning signs, and take control of your health. If you have any questions or concerns, consult your doctor or your healthcare professional. We hope you found this video helpful. Please don't forget to subscribe to our YouTube channel for more on health and wellness. Thank you for watching, and stay healthy.